Stroke kills an estimated 6.5 million people annually, making it the fifth highest cause of death in the United States and the second biggest cause globally, after only heart attacks. Strokes frequently give warning signs before they occur. The key is to recognize them and act quickly. In today's video, we'll go over 9 critical stroke warning signs to look out for, as well as important tips and emergency steps to take if you suspect someone is having a stroke. Let's get started. Number 9, one-sided sudden numbness or weakness. One of the most common and recognizable signs of a stroke is sudden numbness or weakness, especially on one side of the body. This can affect the face, arm, or leg, and often comes on unexpectedly. According to the American Stroke Association, approximately 80% of strokes result in some form of one-sided weakness or numbness. This occurs because most strokes affect one hemisphere of the brain, which controls movement and sensation on the opposite side of the body. These are the main signs to look out for on one side of your face. It is difficult to lift or grasp anything. When one arm is drooping or feels weak or numb, inability to raise both arms equally, one arm may droop and one leg may become weak or numb, which frequently makes walking difficult. These indications are your body's method of notifying you. Something is wrong, timing is important. Number 8 is sudden confusion or troubles speaking. A stroke can directly disrupt the brain's language centers, resulting in immediate bewilderment, difficulty speaking or problem speech. This illness is called aphasia, and it can range from slight difficulties to a full inability to communicate. Signs to watch for include slurred or garbled speech, using the wrong words or speaking in a way that doesn't make sense, and the inability to produce clear, cohesive phrases. Difficulties. Aphasia occurs when a stroke affects the parts of the brain responsible for language processing, often in the left hemisphere. According to the National Aphasia Association, around 25 to 40% of stroke survivors experience some type of aphasia. It's important to note that these changes frequently happen suddenly and without warning. Before we move on to the next critical warning sign, let's take a step back and make sure we understand what a stroke is. A stroke occurs when blood flow to a section of your brain is interrupted or diminished, implying that brain cells do not receive the oxygen and nutrients they require. Without oxygen, brain cells begin to die, which can cause lasting damage. There are 2 main types of strokes: ischemic stroke. This is the most frequent form, accounting for around 87% of all strokes. It occurs when a blood clot plugs a blood artery in the brain, cutting off the oxygen supply. Heart disease and a family history of stroke. Having one or more of these risk factors does not guarantee you'll have a stroke, but it does enhance your odds. The more risk variables you have, the higher the danger. The good news is that many of these risk factors may be modified or controlled, such as quitting smoking, start exercising more, lose weight if necessary, and keep your blood pressure, blood sugar, and cholesterol levels under control. By making healthy adjustments and controlling these issues, you can lower your chance of having a stroke and improve your general health. Number 7 is sudden vision problems. Sudden shifts in vision is another important warning symptom of a stroke. This can occur without notice and may manifest as abrupt clouded vision, double vision, seeing 2 pictures of the same object, partial or total loss of vision in one or both eyes, trouble focusing or following moving things with your eyes. Vision difficulties arise because a stroke can harm the portions of the brain responsible for processing sight or impact the nerves that govern eye movement. The brain's occipital lobe, which is responsible for vision, or the optic nerve, might be damaged during a stroke, causing these disorders. According to the American Stroke Association, around 30% of stroke survivors endure some type of vision impairment. This can include partial vision loss, double vision, or difficulties with depth perception. In some situations, eyesight may improve with time, but in others, the impairment may be permanent. A study published in Stroke Research and Therapy discovered that vision difficulties after a stroke can greatly influence quality of life and may also delay rehabilitation. The study found that patients with visual abnormalities after a stroke had a harder time recovering than those without. It is vital to remember that Even if vision problems appear to heal up fast, they should never be neglected. Brief vision problems, known as transient ischemic episodes, are commonly referred to as mini strokes, are warning indications that a big stroke may be on the way, and they require rapid medical treatment. Research shows that up to 15% of people who have a TIA will experience a full-blown stroke within 3 months. So, if you or someone around you suddenly experiences vision problems, whether it's blurry vision, double vision, or difficulty focusing, treat it as an emergency. Getting medical help quickly could prevent long-term damage or even save a life. Number 6 is sudden dizziness or loss of balance. Strokes can disrupt the brain's ability to control balance and coordination, leading to symptoms like sudden dizziness or vertigo. These symptoms can be seen in strokes affecting the brainstem or cerebellum, which are responsible for balance, coordination, and muscle control. Strokes in these areas can be dangerous as they control essential functions like breathing and heartbeat. The National Institute of Neurological Disorders and Stroke states that strokes involving the cerebellum or brainstem can account for up to 20% of all strokes. Vertigo associated with a stroke is usually milder, but more serious than ear-related vertigo. A 2014 study found that 3 to 4% of people experiencing dizziness or vertigo are actually experiencing a stroke. It is crucial not to dismiss these symptoms as minor problems, as they could signal a major medical emergency. Number 5 is sudden severe headache. A sudden severe headache with no clear cause can be a warning sign of a stroke, especially if it is unlike any previous experience. Symptoms include neck stiffness, facial pain, and vomiting, which are particularly associated with hemorrhagic strokes. These strokes occur when a blood vessel in the brain bursts, causing bleeding into brain tissue. Although less common than ischemic strokes, hemorrhagic strokes can be more deadly, making it essential to seek medical attention immediately. The American Stroke Association reports that 133% of hemorrhagic strokes account for a disproportionate number of stroke-related deaths. Number 4 is sudden nausea or vomiting nausea. And vomiting are often linked to strokes affecting the brainstem or cerebellum, which are responsible for balance, coordination, and essential bodily functions. These strokes can disrupt normal signals sent to the digestive system, leading to nausea and vomiting. Although not as commonly discussed stroke symptoms, they should not be overlooked, especially when sudden and without clear cause. If you or someone you know experiences sudden, unexplained nausea or vomiting, seek immediate medical attention as every minute counts. Number 3 is sudden drowsiness or altered consciousness. A stroke can produce unexpected changes in level of consciousness, such as unusual tiredness, trouble remaining awake, confusion, or disorientation, fainting, or losing consciousness. These symptoms can signal a big stroke or one affecting crucial parts of the brain. Remember that any rapid change in consciousness level necessitates an immediate assessment. Number 2 is sudden sensory changes. Beyond numbness, stroke can cause other sensory disturbances, tingling, or pins and needles. Sensations, loss of sensation in parts of the body, and altered perception of touch or temperature. These symptoms often accompany weakness on the same side of the body. These may not seem as bad, especially if they are experienced on their own, but they should not be overlooked. Any sudden, unexplained sensory changes should be evaluated promptly. Number 1 is sudden difficulty swallowing dysphagia. Symptoms may include difficulty initiating swallowing, choking or coughing when trying to swallow, and feeling like food is stuck in the throat. This symptom is particularly concerning because it can lead to aspiration pneumonia if not addressed. Any sudden onset of swallowing difficulties should be treated as a potential stroke symptom. Importance of quick action. In addition to recognizing the warning signs, it is also important that you act quickly. When a stroke is suspected, it's crucial to remember the acronym Stroke treatment is crucial, as every minute a stroke goes untreated results in an estimated 1.9 million brain cell deaths. Early recognition and treatment increase the chances of survival and recovery. It is essential to call emergency services immediately. If you or someone you know experiences any of the warning signs of stroke, as symptoms typically come on suddenly, even if symptoms seem to improve or resolve on their own, it is crucial to seek emergency medical care. Being aware of these warning signs and acting quickly can significantly improve stroke outcomes and potentially save lives. Critical stroke warning signs before it happens. This video is a valuable resource on health and wellness topics. It encourages viewers to share their experiences with stroke warning signs and stay informed about their potential risks. The video encourages viewers to give a thumbs up, share it with friends, and subscribe to the channel for more educational content. The feedback from viewers helps build a stronger, more informed community. Recognizing early warning signs of a stroke can save lives by reducing the risk of severe damage. The video concludes by expressing gratitude for the support and encouraging viewers to stay safe.